For patients with AL amyloidosis, we need very effective therapies that act very rapidly to reduce the toxic free light chains. We have some quite effective therapies based on bortezomib. However, we still need even more active therapies. And these therapies must be safe and must induce very deep and rapid hematologic responses. So daratumumab is a monoclonal antibody that targets the CD38 antigen that is in the surface of the plasma cells, which produce the toxic light chains. Daratumumab has shown in patients with multiple myeloma, both in a subcutaneous formulation and in an IV formulation, that it is very effective and also that is quite safe with an acceptable toxicity profile. Also, we have data in patients with AL amyloidosis, with relapsed refractory AL amyloidosis, which show that daratumumab is very effective and also has an acceptable safety profile in these patients. So it is quite logic to move forward to add daratumumab on top of the combination of CYBORD. We have many data also from myeloma patients that this is something that we can do with safety and will increase efficacy. The subcutaneous administration of daratumumab is a major advance. The intravenous formulation takes a lot of time to administer, takes several hours, and also specifically for patients with AL amyloidosis may be associated with volume overload because it has to be administered in about half to 1 liter of saline. So for patients with AL amyloidosis who quite often they have cardiac dysfunction and cannot tolerate increased volumes of fluids, the subcutaneous administration is probably the optimal way to administer a drug. In addition, it seems that with the subcutaneous administration, we reduce the frequency and the severity of administration-related acute reactions. The ANDROMEDA study was a prospective randomized study in which the primary endpoint was the complete hematologic response rate in patients with newly diagnosed AL amyloidosis. In patients who were treated with combination of subcutaneous daratumumab with CYBORD, the complete hematologic response rate was 53%, and for patients treated with CYBORD was 18%. So this substantial improvement in the complete hematologic response rates was also translated to an increased time to deterioration of major organs such as the heart or the kidneys, or time to disease progression, or time to need for subsequent therapy or death, and was also associated with a substantial improvement, a doubling actually, of the rates of organ responses at 6 months. Regarding toxicity, we didn't see any new signals of toxicity, and the safety profile was consistent with what we know for subcutaneous daratumumab and CYBORD. Well, I think that in view of the substantial improvement that we see with the combination of daratumumab and CYBORD in patients with AL amyloidosis, I would expect that this combination will become the new standard of care. It is also very important that this is a global study, will be probably globally available, and probably the first officially approved treatment for patients with AL amyloidosis. As far as I know, the company has submitted or will submit for approval in the authorities of several countries across the globe. And definitely it's probably a game changer therapy.